infection when it gets inside.
Doctors are calling it a pioneering technique to restore sensation to the eye. It's an innovation that could prevent blindness, a new nerve graft transplant that's been used on several patients at Toronto's Hospital for Sick Children. Christine Birak spoke with the very first to undergo the procedure.
What doctors and surgeons at Sick Kids have done is fairly remarkable. Imagine having no feeling in one eye. You'd be able to see, but you wouldn't be able to feel wind or dust or an infection when it gets inside. It usually ends up leading to scratching and scarring of the cornea and eventually blindness. That was the scenario for Abby Mesner. She had a brain tumor removed when she was 11 and lost feeling in her left eye.
Everyone's like, wow, she had a brain tumor and she's fine, and you don't really think that everything that's holding me back is my eye.
To protect it, she had to stop playing most sports, avoid going outside too much, and even going to the mall. Still, her eye ended up badly damaged. 4 years later, her doctor, Asim Ali, came to her with hope. Eye doctors and plastic surgeons at Sick Kids had come up with a plan. They transplanted a nerve graft from her leg into her eye, attaching it to another nerve and tunneling across and running the nerve through and down to her other eye.
Basically brings sensation from another part of the face through an extension cord, bring it across and put it into the cornea where there was no sensation.
Just a few months later, Abby felt something in her left eye, a tingling or a prickling that people feel sometimes when their foot falls asleep.
It was a weird feeling, but when I get it, I was kind of like, okay, it's working. Like, if I can feel the path going from my nerve and it's to my eye, then I'm like, it's working. So it was a good feeling.
While Abby was the first, doctors have now performed this technique on 7 other patients. And now doctors from other hospitals are coming to watch, learn, and spread this technique across the country. Christine Birak, CBC News, Toronto.